All right, guys, so this is the last section of chapter 12, 12.5. This is going to deal with specific interactions between the drug and the host. So there are a few categories when we think about side effects for drugs. The first one we'll talk about is direct damage to tissues, and this is through the toxicity of the certain drugs that can interact with the host. The next one would be allergic reactions. Unfortunately, some of these drugs can cause what is known as an allergic reaction within the body. And the last one is going to be with disruption in the balance of normal microbes that are found in your body. Again, we've kind of talked about this a little bit, and you've been reading about it more in your Follow the Gut text. All right, so toxicity to organs. So when you have drugs that are toxic to the body, there are some main targets that are associated with it. The liver is a huge one, as well as the kidneys, the GI tract, cardiovascular system and blood, unfortunately the nervous system, respiratory tract, and then skin, bones, and teeth. So these are all potential areas in the body that might be ill affected by the use of a particular drug. So I'm just going to point out a few of the major adverse toxic reactions. Tetracyclines, there's a big one. It has a lot of GI issues with diarrhea, enterocolitis. I'll show you some pictures of discoloration of the tooth enamel that can occur. Polymyxin, unfortunately, can cause a lot of kidney problems. Penicillin G specifically can cause skin abnormalities. When you get to the antifungals, amphotericin B causes some kidney problems as well. When we get to the antiprotozoan drugs, chlorinoquine is a fairly toxic drug. It can cause some vomiting, headache, itching. And then mostly I'll point out with some of the antivirals, it can cause nausea, nervousness, lightheadedness. AZT, which is a common antiviral used these days for inhibiting HIV, unfortunately can cause immunosuppression as well as anemia. All right, so this is what I was talking about with the tetracyclines. There can be some bad damage to the teeth, causing discoloration, brown or gray coloration. And essentially what happens is the tetracycline itself can actually just bind to the teeth enamel and causing this problem. As well, it should be limited in pregnant women because of liver damage it can cause. And as well, it can cross the placenta, and the same thing that you're seeing here on the teeth, it can damage bones and teeth in the baby in the womb. So I mentioned diarrhea before, a common GI problem. This is probably the most common complaint associated with any type of oral antimicrobial therapy. My son, unfortunately, has been on a lot of antibiotics in his days for ear infections and strep and throats, and I clearly remember the side effects with amoxicillin. So if the thing you have to be worried about with diarrhea is that it can progress from just diarrhea to severe intestinal irritation or colitis, and some drugs can directly irritate the intestinal lining as well. So hopefully you've picked this up from Follow Your Gut, is that essentially the diarrhea is killing off the normal flora in the intestinal microbiota. So that's essentially where the diarrhea is coming from, killing off those normal microbes found within your body. All right, so the second major class of the body's response to drugs would be an allergic reaction. So we're going to get into this a little bit more in regards to the immune system in chapters 13, 14, and 15. We'll talk about this term antigen. So essentially the drug is acting as an antigen. Other things can act as antigens, but in this case, the drug itself is acting as an antigen, and it stimulates an allergic response within the body. So this can be provoked by either the intact drug molecule itself or like a byproduct of that drug being in your body. And a lot of times this is from the body's metabolic alteration and changing around of the actual drug once it gets inside your body. So we'll just go through this brief sort of overview of what would actually happen when a broad spectrum antimicrobial is introduced into the body. So we'll talk about it here and talk about it in this diagram here. So in this particular case, there's an infection, and you see the normal biota here is in the intestine. Those are in white, as well as there's a few of these potential pathogens that are marked off in red. This particular pathogen is resistant to the drug, but because it's so few in numbers, it's being held in check by the other microbes. So as you're thinking about these broad spectrum antimicrobials, they are effective at treating the infection, but what they do is they go about and they destroy all this normal microbiota as well, even ones that are far removed from the original infection. So in this case, the original infection is in the throat, but all these normal microbes in the gut are going to be killed off by this broad spectrum antimicrobial. Okay, so the drug will enter the body, in this case circulating and killing off the pathogen in the throat, but as well killing off and destroying all that beneficial microbes. But unfortunately, this microbe has become resistant to the drug in the gut. Okay, so in that case, what can happen is what's known as a superinfection, and in this case, the beneficial residents are destroyed through the antimicrobial therapy, and then those resistant drug microbes can actually take a foothold and start multiplying and essentially cause a superinfection in a place different in site from where the original infection was. So if you recall, the original infection was in the throat, but now this unfortunate superinfection has occurred in the gut. All right, so that's the end of chapter 12. Looking forward to seeing you guys on Tuesday.